Hello there. Good evening. An extremely happy good evening to you. I am Dr. Randy Fink, and this is Fertility with Fink, the place that you are supposed to be. Every Tuesday evening at this time, we are here. It's 5 o'clock p.m. Central Time, which is 6 on the East Coast, 4 o'clock in the mountains, and 3 on the West Coast. I got it right this time. Boy, that's challenging to me every time I have to try to say it. Hey, how you doing? It's good to see you here. Hope your weekend was great. Last week we sat and we talked for a whole good hour long, and I forgot to even say Happy 4th of July. I hope your 4th of July weekend was good, and that your summer is shaping up really beautifully here. This past weekend in Pensacola, Florida, was a very special time. It was the Blue Angels weekend down on Pensacola Beach, and so everybody comes down to watch that, and it's really something special. Really was a very good time. Although it was hot and there were a lot of people down there, it was good to be there, and it's good to be here. And hello to all my friends who are joining. Hey to Zaneta, thank you for being here as always. Good afternoon. Han Miller, nice to see you. We've got Kowser, we've got Sharmilla. Hello, Marcella. Thank you for being here. Rosa, good evening. And Kelsers, hello. We've got our couple of different Instagram feeds here. This is mine, Randy Fink MD, and here is New Life Fertility. And over on this side is Facebook, LinkedIn, and YouTube. So we try to get to all your questions here, talking about fertility and everything women's health tonight. If I can't get to you, because as the questions start to come in, we oftentimes end up getting a little behind on able to answer. And if that is indeed the case, please feel free to email me. And that's askfertilitywithfink at firstfertility.com. Again, that's askfertilitywithfink at firstfertility.com. Last week, when we were talking, we talked about all those things. We talked about this crazy roller coaster ride of fertility, and how difficult it is sometimes, to be able to face the realities and the discomforts associated, not just with fertility, but honestly with all those curveballs that life throws to us. And I posed a question, and the question still stands: what do you do to deal with the unknown? What do you do to handle your stress? Some people go running. Some people do different types of exercise, like Zaneta told me the type of exercise that she does. Yeah, I'm not going to say it out loud. Some people commune with nature or hang out with friends, and so I thought I'd pose the question again here tonight, because I'd really like to know your answers. And I thought, in addition to trying to answer some of the questions that we have, about fertility and women's health, maybe we could also ask you to throw in just your thoughts and ideas. And I wanted to share something that has been very meaningful to me as it pertains to dealing with stress and anxiety. And as we get to that, also just to say hello to Zulika and the Styles family. Angelica, thank you for being here. That's a great name. Hi, Toria, Florida girl, nice to see you. Marta, nice to have you here. Okay, so before we dive into questions, I want to share with you the thing that to me has been very, very useful, and that is an app that is called New Calm, and that's Nucalm. New Calm. New Calm is, forgive me here, because I'm just going to take a quick peek at something. Sorry about doing that. Okay, got it. We are back there. Sorry if I dropped you. New Calm, Nucalm, and you can go to the website, which is newcalm.com. It is, and that is different from, there is also an app called Calm, also at calm.com, and that is something that is completely different. New Calm is a very unique form of science, and I was turned on to this by a friend of mine who is a retired U.S. Navy SEAL, who, as you might imagine, has seen some things in his life that Human beings really aren't kind of meant to see, and having to deal with some experiences that is very hard for people to process. What New Calm is it's basically, you listen to it and it sounds like music. It sounds like kind of spa music, actually. But what it is that's underneath is this very highly engineered difference in frequencies. And so what that means is that one ear is hearing one frequency while the other ear is hearing a different frequency, which sounds just like music. But as you listen to it, what it does is that it puts your brain into certain waveforms, into the waveform for the deepest level of cellular repair, which is really very interesting, because when you do it, it's almost like getting an extra several hours of REM sleep. As you listen to it, you will probably go into a state that sort of makes you feel like you've been hypnotized, or kind of a lucid dream. You almost think it feels like you fall asleep during it. But really what it's doing is that it's putting your brainwaves into relaxation from the level of the brainstem, which is really, really fascinating stuff. And when you're done with that, your problems are still there. It's not like the problems go away, but what does happen is that you just don't seem to care about them so much anymore. It really relinquishes a lot of the stress, the real cerebral kind of stress that we feel. New Calm, NUCALM. There are several different actions that you can do within New Calm, and one of them is for healing. It's called Deep Repair, I believe is what it's called. There's one specifically for sleep. There is one specifically for energy and focus, one for creativity. It's a subscription-based service, and I was able to get from him a coupon for anybody who wants it. Use the code SLEEP, SLEEP, and that gives you a 15% discount. There are annual plans, there are monthly plans, there are weekly plans. There are lifetime plans, but the code SLEEP gets you that discount. There's no reason not to give a discount, or to get a discount, because if they're giving it, you should take it. But I highly recommend it. It has been very, very helpful to me. I don't get anything from it if you sign up for it, but it's been very useful to me. And that's kind of where that's my go-to place for trying to shed the anxiety. And so please, I hope you will have a chance to avail yourself of that. How do you handle your anxiety over this rocky road? And maybe not just about fertility, but also how about just about life and the curveballs that life throws to us? So please answer back and let me know. Meanwhile, let's dive into some questions here. Whoa, there goes my thing that just got moved out of the way. Let me see if I can set that back to where it belongs. All right, sorry about that. Kelzer says, thank you, Dr. Fink. Because of you, I have not one, but two beautiful 12-week-old girls. Congratulations. Boy, that makes me so happy. I love to hear stories like that. Please send me a picture and I will post it for sure. Thank you so much again. Zulika says, I listen to frequency healing, and it's awesome. So you may have heard of something that's called binaural beats. And you can go to like Amazon Music or to Apple Music, and there is a binaural beats playlist. And that essentially does the same kind of thing, but very quickly your brain decodes that. Binaural beats means that you're getting two different frequencies, one different frequency from each ear, but when it's the same kind of thing as it is with binaural beats, your brain figures that out within a couple of days and it doesn't keep working. So that's kind of what New Calm does, but with a little difference in the technology. But Zulika, I'm so glad to hear you do that, because now it makes me feel like I'm not the only one. Florida Girl says, would you recommend 2 or 3 months of Lupron Depot to suppress endometriosis. Last time I did 2 months and I had a blighted ovum. 2 months is really all that you need there, Florida girl, because suppressing endometriosis or turning off the effect of endometriosis in the uterine lining has been shown to work with simply 8 weeks of suppression. A blighted ovum is what's known as an anembryonic pregnancy, and that comes from the embryo itself. So that would not have had to do with your endometriosis. That's an embryo problem. It has to do with the genetics, the chromosomes of the embryo. So it sounds like you actually got the effect that you wanted from the Lupron there, which was the suppression, because you actually got an implantation. You got the pregnancy to implant. The problem was the pregnancy itself just wasn't the right pregnancy. Again, a chromosomal issue there. So I do think that 2 months is really adequate for that. And depending on when you did it, you don't necessarily have to do it again. There's some evidence that shows us that using suppression gets you about 6 months of suppression of endometriosis. So if it's been within the last 6 months, I think you can make a good argument that you might not have to do it again there. I wanted to say thank you, Zulika. Zulika says, my baby turns 1 tomorrow. IVIG and LIT were a game changer. So glad to hear. 1 year old. My goodness, time flies. Rosa asks, at 43, can I wait to go into labor spontaneously at 40 weeks, or is it better to induce earlier? I think that you can wait to go into labor at 40 weeks. Now, I wouldn't want you to go much beyond 40 weeks, and every obstetrician will have a differing opinion on that. What if my cervix is not ready to be induced at 39 weeks? I do not think that the age of 43 is obstetric criteria for alone for induction of labor. So if your cervix wasn't favorable, I don't think that they need to induce you at 39 weeks with an unfavorable cervix. Around 40 weeks, I'd say let's think about getting a move on. And again, I wouldn't want you to go beyond 41 weeks at all. And that's really for anybody, because remember, the placenta is an organ that has a fixed age. It has a fixed lifespan, and the older we are, the more quickly it may start to wear itself out, which means the blood flow going to the baby may be altered, and bad things start to happen. So every doc, I don't deliver babies anymore, but every doc has their own opinions on that, and your practice will probably have a policy on what they do with folks who are of what we call advanced reproductive age, or what they say is advanced maternal age at 43. So gosh, Rosa, I cannot wait to see your baby for sure. Oh my gosh, yes. I want to throw a special shout out to Angelina Foxy up in the great state of Minnesota, one of the finest nurse practitioners in the cardiac realm there are. She has helped me through some issues, and I appreciate you being here, Angela, tonight. Thanks. Schwartz Diamond. Hello. The Meg Johnson. Bryn. Hello, Bryn, who asks, are progesterone supplements still beneficial at 14 weeks? I'm scared to stop, and I want to stay on. Really, a progesterone supplement probably isn't doing much for you by 14 weeks. So we use that supplementation because when you have done a medicated cycle of IVF, we have given you all your progesterone, right? So if you're doing a medicated cycle, you get your estrogen, we're giving you the progesterone in oil. You need a little extra progesterone because it's helpful at the level of the endometrium. It's a local effect. But you do that until the placenta takes over making that progesterone on its own, which is typically at about 9 weeks. So in most programs, we continue progesterone until about 10 weeks. By 14 weeks, Bryn, I don't think it's really doing you much good. So I really do think it's fine to stop. But I understand how it's anxiety to stop it because it's fear of the unknown. People talk about depression and anxiety and what is the difference. Well, obviously we know what it feels like, but really depression is worries about and pervasive thoughts about the past and what the past has done to us. Whereas anxiety is worries about the future. And so, is it any wonder that the whole fertility process isn't bedecked in anxiety because we don't know what's going to happen tomorrow. And certainly once you get pregnant, oh, for sure, that's a real thing because every day is a worry about your pregnancy. Well, I will tell you here that even once you have the baby, the worries persist because then it's about, well, how is my baby sleeping? Is my baby getting enough milk? Is my baby growing? Is my baby going to be successful and happy and well developed? And all those problems, and it never really ends because then it's going to end up being, how is my kid going to do in school? Is my kid making friends? My kid has to get a driver's license now. Are they going to be safe on the road? Now they're starting to date. What's going to happen to them in the dating world? The worries really honestly just continue. And that's the anxieties of parenthood. And I think the key is to keep them in control, not to let the anxiety rule you, but rather to let anxiety be a guidepost for your life to tell you what's safe really and what's not. How do you handle your anxiety? That's the question we're asking tonight. If you would, please answer me. I'd like to know. But Brent, I think you can stop your progesterone there. Ariel asks, is it okay to transfer an untested embryo with a tested embryo? Well, normally we say that if you're transferring a tested embryo or a euploid, meaning chromosomally normal blastocyst, then we usually want you to transfer one embryo at a time, because what we want is one healthy pregnancy at a time. And so to put back more than one embryo really may not increase your live birth rate. What it does is that it really increases your risk for problems that can result in the pregnancy loss. So as a rule, generally I say, I don't think you should be transferring a tested with an untested embryo because of that factor, that we want one healthy baby at a time, and we don't want to increase the risk to that euploid embryo, to that tested embryo, because that one already has a 65% probability of getting you a pregnancy. Let's see, supplements you can take to get ready for an embryo transfer. The answer is yes. There are 5 supplements that you take for embryo transfer, and they go a little something like this. Your prenatal vitamin, vitamin D, vitamin E, CoQ10, and L-arginine. Those are the 5 evidence-based supplements for embryo transfer. Everybody doing a transfer should be on them. What about the prenatal? Should I be on a $200 prenatal vitamin? And the answer to that is no. Really, all you need from a prenatal, 400 micrograms of folic acid. Maybe your prenatal has 800 micrograms. Maybe your prenatal has 1,200 micrograms. Guess what? All you need is 400. So that's my thoughts about a prenatal vitamin and embryo transfer. Yes, you should be on those 5 supplements. Let's see. Angelica says, I had a hysteroscopy 2 months ago and had some scar tissue removed. I just found that I am pregnant. Oh man, that is awesome. I'm so happy to hear that. I am 3 weeks and 5 days and worried about a miscarriage. Well, of course you're worried, Angelica, because this is, again, it's part of the unknown. 3 weeks and 5 days means that you are barely pregnant, right? That you just had your pregnancy test and it just turned positive. So I think that is really great news. I am so happy to hear it. What you want there, friend, is to be able to hear, or to see the heartbeat. So once we look with ultrasound and see the baby's heartbeat, we know that there's about a 95% probability that your pregnancy continues. So that's the best news that we can hope for. 95% probability is pretty good numbers there. The scar tissue removal, it depends on how dense that scar tissue was, Angelica, as to what sort of risks that poses to you. But if they didn't send you out of there needing extra estrogen, or perhaps needing more needing a balloon on the inside in order to keep the sides from sticking together, which apparently they didn't need to do again because you got pregnant, which means you had an implantation. So I think hopefully that scar tissue business is all in your past. Congratulations. Boy, I can't wait to see your picture too. That is fantastic. Are progesterone supplements beneficial? We just talked about that one. Hi to Angela Sack. Thank you for being here. Lana Toast, Erica Alyssa, howdy. I've had preeclampsia twice, Ariel says, with both of my pregnancies. Is it true that every pregnancy I have now, I will have preeclampsia? So if you're not familiar with preeclampsia, that is a hypertensive disorder of pregnancy. No one's really sure why preeclampsia occurs, but it's thought to have something to do with some of the hormones that come from the placenta. The highest risk for preeclampsia typically happens in the first pregnancy, but if you've had preeclampsia in 2 different pregnancies, the odds are pretty high that you will have it again. What can we do about that? Well, a baby aspirin. And aspirin is really the only intervention that has been shown to have a preventative, potentially a preventative effect against hypertensive disorders in pregnancy. So I would suggest for sure that you be on a baby aspirin. Hi to Tracy in Miami. Thank you for being here with your cats. Presumably the cats are watching as well. Over here on New Life, we've got Priyan, I believe that says. Hi to M. Clark, Sarah Humphrey. Thank you for being here. Ms. Does that say Chastity? Thank you for being here as well. We've got a couple of Instagram feeds. We've got Facebook and YouTube and LinkedIn over here. Please feel free to throw your questions in, and we want to know. Nobody's answering me. What do you do to get rid of your stress? How do you handle the anxiety? Hi to Valerie. Angela says, I used thawed donor sperm for an IUI 20 hours after Avidril, but the thawed sperm remains viable for 12 to 24 hours, but closer to 12, shorter than fresh sperm lifespan. So is the timing for ovulation wrong because the sperm would have died? I'm not sure where that information, where you're getting that information, Angela, because in fact, sperm in the vagina can really live for up to 5 days. Now, it's true that fresh sperm probably does have a much longer time span, but even frozen thawed sperm, I would expect to be able to survive up to 72 hours. The evidence on that shows us that it doesn't really matter when the IUI takes place relative to your trigger shot. Now, traditionally, most programs will do their give your trigger shot, and then either 24 or 36 hours later will do the insemination. And of course, if you're not familiar, an insemination is where we take the sperm, we prepare that sperm in the laboratory so that we're separating out the best and the strongest swimmers, and we're placing them inside at just the right time. So we're trying to maximize the odds of sperm being able to meet egg. So the evidence shows, you could do your IUI at the same time as you do your trigger shot, or you could do it 36 or really even 48 hours later and probably have the same results. 48 hours is starting to get a little long for me because what we want that sperm to be there when the egg is released, and that often happens around that 48-hour mark. So 36 hours is kind of where most programs have fallen. But the truth of the matter is you could get it, 36 hours beforehand when you get your trigger shot, and it should be fine. But whether that is frozen sperm or fresh sperm, you should be fine at that 36-hour mark. Hey to JM Dots, haven't seen you for a while. Sarah and La Mujer, I believe that says, hello, how are you tonight? So, what's going on in your world, folks? We're talking about anxiety tonight. Anxiety is really worries about the future, and how do you deal with your anxiety? I shared that I use an app that's called New Calm, Nucalm. You can get a discount at New Calm by using the code SLEEP, SLEEP, as a coupon code at the checkout. There is another app that is called Calm.com, or the Calm app, and they advertise actually on TV. And what that is it's usually a series of sounds, and those sounds are designed to just kind of in general help relax you. Um, some people will go outside and listen to the sounds out in nature. I used to live in South Florida, actually in the Florida Keys, and we were surrounded by nature. Really lived in a hammock, which is kind of like a jungle. Not that I lived in a hammock that swings between trees. I actually lived in a house, but it was in the jungles there, and it was very nice to be able to go out and close my eyes, and I would try to do it for about 5 minutes a day, just kind of centering myself and sort of being in touch with what was going on around me. That was the term for that is mindfulness, and that mindfulness training was using the sounds of every bird, really stopping and listening to every sound that was happening around me. And that allows the brain to get itself into a very different kind of state. I began to hear birds that they became like friends to me. They became, I would hear the same birds day in and day out with very unique, specific calls. And I could tell the difference between them. I mean, it's really fascinating because there's so many distractions and so much stimuli going on in the world around us that it's really hard to be able to stop and smell the flowers, as it were, to really hear what's going on. So you can do that kind of mindfulness with nature outside, and it doesn't have to be sitting in a jungle hearing the birds. It may be outside your crowded street, even in Manhattan, where you're hearing lots of horns and sirens. You hear children playing. You hear clanking of trash cans and people walking. You hear people screaming at each other. All manner of different things there you may hear, but you just pay attention to each individual sound, and that's called mindfulness. Being mindful helps your brain tune out what's not important in your world, and really goes far to help to kind of chill you out. So mindfulness is an important one. Florida Girl says listening to worship music or reading my Bible helps me. Spirituality is another, thanks for bringing that up, is another very important aspect that many of us lean on. Some people aren't as comfortable in times of need, in times of trouble, turning to those things with which we are comfortable, maybe the spirituality with which we are raised, leaning towards God, or towards a higher power, whatever that means to you, is an important one, and I think that's a great one too. We lean on those kinds of traditions in both happy times and in sad times. That's why there is often religion in weddings, because of the association with that culture and that heritage and what we have grown up with. It brings us comfort and brings us closer to God. And certainly, of course, in times of distress. The Psalms said at funerals can be very comforting, and knowing that our loved ones are with God when they are no longer of this earth certainly brings comfort. So I understand there, my friend, why in times of stress related to fertility, God is still a very important part. Angela says, is it possible to ovulate before 36 hours, even even with a trigger? So the answer to that is yes, you could ovulate before that. But still, the goal is that while we want to have sperm there before the egg is released, sperm getting there still has the ability to fertilize an egg. So what can happen is that if you wait a little too long to do a trigger shot, that can result in you ovulating on your own, before the trigger shot has a chance to work. And that kind of thing can happen. And that's why normally when we look by ultrasound and we're looking at the size of the follicles in the ovary, I typically think of about an 18 millimeter size as being one that is mature. And I would trigger you at about 18 millimeters. Now, for women who are a little bit older or advanced reproductive age, certainly women in their 40s, we tend to take that down a little bit, maybe by 16 millimeters. We would say that those eggs are mature, and we would trigger a follicle at about 16 or 17, maybe not all the way to 18. But really, in nature, you don't ovulate when your follicle is 18 millimeters. We say it's of a mature size, but you may not release it until it's 24 millimeters or 26 millimeters. It may be several days after that. Angela says, no, I was triggered at 22 millimeters. So in fact, yeah, that was a little longer than I would have waited. And I'd say that's probably longer than most programs do. Usually we think about triggering a little bit earlier than that if we can. Now, is there anything wrong with triggering at 22 millimeters? No, I don't think there's anything wrong with it, but you're right. At some point you're going to ovulate on your own. And what we want to be able to do is to get that sperm there before you release the egg. Let's see. Svetlo, I believe that says, hi, thanks for being here tonight. Hello to Gretchen W. and Rebecca V. On the Facebook and YouTube side. Thank you for being here this evening. Let's see, it's about halfway past the hour, so we've got about another 30 minutes to be here with you. Fertility with Fink is a production of the First Fertility Network. My name is Randy Fink, and I am a fertility gynecologist here at New Life Fertility in Pensacola, Florida. We have offices in New Life has offices here in Pensacola, our home office in Mobile, Alabama, in Dothan, Alabama, in Panama City, and in Tallahassee. The answer is yes, we do see patients from all over the country. I am happy to consult with you no matter where you are, and we do see patients here that come from all over the United States to be a part of our IVF program here. So again, happy to help you in any way that we can. The First Fertility Network is a network of top-notch, first-class fertility practices nationwide, and you can look at their website, firstfertility.com, to find a specialist near you. Let's see, Perry Myslova, I believe that says. Sarah, hello to you. If I'm saying it right, Perry Myslova, I apologize if I'm saying it wrong. I hope you'll forgive me. My friend, who is a 47-year-old with donor eggs, got 2 euploid frozen embryo transfers that failed. What additional testing would you recommend before trying again? So that, as we say, is one of the most frustrating scenarios we have. And that's when we place euploid or chromosomally normal tested embryos back inside, but they don't stick. So the highest probability of success that we have with IVF is transferring a tested euploid embryo, one with normal chromosomes. By the time you have transferred 2 normal embryos, you should have an 83% probability of a pregnancy. Really of walking away with a live birth there. If your friend has to do another transfer, that would get her to a 95% probability of pregnancy. So 83% is not 100%. And so that's the first thing I would caution. But really, most of the time, 83 is a pretty good number. And so I would really hope to see a positive pregnancy test by that point. So what else would we do? Well, after 2 euploid embryos, if we haven't seen a pregnancy, I think it's time to start thinking about other things. And that would be things like endometriosis. It used to be that we could only test for endometriosis by doing a surgery, by having a laparoscopy. Now we have the availability of non-invasive testing for a marker known as BCL6. That test is called Receptiva, and BCL6 is an inflammatory marker that's highly associated with endometriosis. It can be tested by a simple endometrial biopsy where we place a little straw on the inside and suck some tissue out and let them look for that marker. Because in the presence of a positive BCL6, your 65% probability of a single euploid embryo drops down to about 10%. And that's why we suppress endometriosis, because when we suppress endometriosis, that 10% number goes right back up to the 65% number we would expect from a single euploid embryo. I would also recommend that she thinks about having a hysteroscopy. I'd want to know for sure that the cavity is normal and that there's not a chronic inflammation inside the uterine cavity, and that's known as CD138 is the marker for that, and that's called chronic endometritis. There's some other blood tests to do. You'd want to look at things like thyroid and turn over some stones, but there is really a particular evaluation that we do in that scenario. So especially using donor egg that's chromosomally normal, I would for sure want her to be evaluated before putting another embryo inside. I have to say also that there is a medication that's called tacrolimus or Prograf, which has been shown to be beneficial, like very seriously beneficial, in folks who have recurrent implantation failure. Now, that medication is taken 1 milligram 3 times daily or 1.5 milligrams twice a day. And was studied in women who have had kidney transplants, because that's usually the folks who are on a medication like tacrolimus. So what they found was these women with kidney transplants were having unexpectedly healthy pregnancies because they were suppressing the immune response that was associated with rejecting a pregnancy. Well, it turns out that rejecting a pregnancy is in many ways the same process as rejecting an organ transplant like a kidney. So tacrolimus would be certainly something that I would want you to consider for your friend there for sure. Zenny says, I randomly, this is going back to the question about stress and anxiety. How do you treat it? I randomly drink a glass of wine, and I also use the Calm app to go to sleep. Fabulous. Sleeping is a wonderful thing when it comes to you. When sleep doesn't come to you, it can be miserable. And you probably are all familiar with really the same guidelines we talk about for sleep hygiene. That if you're in bed and you're not falling asleep, if sleep is not coming when it's supposed to be, or let's say that you fall asleep, but then you wake up and it's 1 o'clock in the morning and you're just tossing and turning, you can't slow your mind down. You can't quiet the noise. You can't make it shut the heck up. What are you supposed to do? That's a perfect time for an app like the Calm app, or New Calm is the one that I've been talking about, because there is actually specifically a solution for sleep there. But you're supposed to get out of bed and go do something else. Go watch a little TV. Go read a book. There is some controversy over whether you're supposed to pick up your phone and start looking at it, because screen time has been associated with lowering the quality of sleep. But I know sometimes I'm guilty of that. I'll pick up the phone and start to read Apple News. I'll start to read the news, look at all the articles, kind of follow things along. look at the magazines I'm interested in, looking at it on the screen. And again, screen time is not always the best thing for us. In fact, in many cases, it is not good for us. But old habits die hard. If you're not sleeping, get your butt out of bed and go do something else until you start to get tired, and then get back in the bed. In most cases, when you do that, you'll start to get sleepy again, usually within about 45 minutes. But if you spend that time laying in the bed, staring at the ceiling, letting your mind go wander to all those places that you really wish it wouldn't, it needs to quiet itself down, then you're going to teach yourself, because sleep is actually to some degree is a learned process. You're going to teach yourself that tossing and turning in bed, that bed is not for sleep, that bed is for worry, that bed is for anxiety. And that is exactly what you don't want, because we all know what happens when we don't get sleep. We end up getting cranky and we end up looking like this. But I did get a haircut at least, so give me some credit, okay? Sarah says, I'm suspicious that I have silent endometriosis, and I'm wondering if suppressing that and then doing a medicated cycle would work, or would it be better to do a modified natural without suppression because it's not confirmed? So you ask a good question there. I don't have a problem with suppressing endometriosis based on a clinical suspicion of endometriosis. So what is a clinical suspicion? Clinical suspicion means that you have the symptoms that may be associated with endo. So you have painful periods. Let's say that it hurts when you have sex. It hurts maybe when you have a bowel movement. Those are the clinical signs of endometriosis. And if we're suspicious, I don't have a problem in suppressing you without testing. So again, it used to be that you had to have surgery for that, but now you can do that with a non-invasive test. Well, what about 8 weeks of suppression for endometriosis if you have no symptoms? Because guess what? The most common presentation of endometriosis is in fact silent endometriosis. So the most common clinical presentation are all those things: painful periods, pain with sex, pain with a bowel movement. But the most common, it's no symptom at all. And so that's one of the things that we can look for with that BCL6 marker. If there's a reason, if it's just anxiety, if it's just worry about silent endometriosis, well, there's no evidence that shows that we should be testing the general population before doing an embryo transfer. No evidence at all. So do I recommend a BCL6 or a receptiva test for somebody who has no history of failing transfers or no history of anything that sounds like endometriosis? No, and nor would I necessarily recommend suppressing you. Now, it may be that even using a little bit of Lupron in a medicated cycle may be helpful for you. But I do like you said, a modified natural cycle. So I think that may be a better way to go, unless there's any indication that you might actually have endo. I got a little distracted there because one of the finest human beings that I have ever met joined on my Instagram side here, and that is Alexis Reyes, who says, I love what you're doing. Knowledge is power, and that's what you're giving us. Thank you, Alexis, for saying that. I have to say, Alexis is really one of the most truly gifted people I have ever encountered. Alexis knows people. She knows what's going to happen to you before it happens. Alexis, if you're still there, I am blanking on your website, but I will happily share that because you are truly one of the world's most gifted, wonderful people, not only being full of love, but full of understanding about the world around us and what is going to happen to people. Alexis is a psychic. Alexis has a gift, and I encourage everybody to reach out to her. Although at the moment, Alexis, I'm blanking on your website, so I can't share it. But if you hear this, please put it in, and I will share it. Nice haircuts, and he says, well, thanks a lot. Oh, hey, to Blaxican Beauty, thank you for being here, and my pleasure, Sarah. Glad to be of service there. Speaking of psychics, a lot of people believe, and there are many people who don't, and I would say that's fine. That's your prerogative. But when someone who is gifted has touched your life, and really is able to, without knowing you or knowing much about you, is able to reach into your soul and uh, and find answers for you, to the questions that maybe you yourself were afraid to ask. I think it's just really a very magical thing. So Alexis Reyes in Miami is her name. Lexi, oh hi Lexi, I haven't seen you for a while. Lexi says, oh, from the south, from the Carolinas. Oh gosh, I am sorry to hear this. Experiencing my first miscarriage after getting pregnant naturally after 5 years of trying. Oh Lexi, I am so sad to hear that, and all of us share our heartbreak with you. Um, it is a cruel thing indeed to deal with trying to be pregnant for 5 years and then to miraculously have it happen naturally, only for that to be taken away. Is a very sad day, and we are all sad with you here, Lexi. So sorry to hear that. What should be my next steps before IVF? Well, so in general, you kind of want to get yourself through the miscarriage. You want your hormone levels to be back to negative, your pregnancy test to be back to negative, and then really you can jump into fertility treatment at any point. I do think it's important to be on the supplements that we've talked about for egg quality. Why did that miscarriage happen? Well, in all probability, it happened because of chromosomal reasons. Chromosomal or issues with the genetics. And unfortunately, what happens there, nature is pretty good about keeping us from having babies that aren't normal, although sometimes it does happen. Most of the time, either the sperm will not fertilize the egg, or if it does fertilize the egg, the embryo won't implant. In fact, it's said that more pregnancies in that way, that the pregnancy doesn't even implant before you even know that you had a fertilization. Or sometimes it will implant, and it'll just stop growing. But very sad for you, Lexi, there, and we certainly wish you really all the best. Thoughts and prayers. Would you recommend Neupogen shots for an endo patient with recurring losses? I've suppressed before each FET and had a laparoscopy. So, Neupogen is a medication that is typically used for folks who are undergoing chemotherapy, whose white blood cells will be destroyed as a result of the effect of chemotherapy on the bone marrow. And so when you give someone Neupogen boosts up their white blood cell count while their own white blood cell count may be tanking. In the fertility realm, when we give Neupogen to someone with normal white blood cells, we may end up with white blood cell counts in the 30 to 40,000 range, whereas normally they're in the 5 to 10,000 range. Neupogen is said to have some effect on the immune response as it pertains to pregnancy, but really, its best evidence is for reasons that are hard to explain. It can help thicken the lining of the uterus. So Neupogen, I'll often use for people who take their estrogen, but for whatever reason their lining doesn't thicken up, and so Neupogen is useful in that regard. I don't know that it has a specific indication as it pertains to endometriosis. So I'd be a little, personally, I'm leery of that. There are programs who will routinely use Neupogen as part of their immune protocol. And the thinking there is, well, we're going to throw the kitchen sink at you, because if we don't know exactly what the problem is, whereas really most cases the problem is more likely the embryo. But if we can't say for certain, we don't know, we're going to throw everything at you we know, and hopefully something will work. And the reason for that is, well, because, there's going to be some component of the population, some cohort of the population for whom that medication may be helpful. So the idea is, let's give it to everybody so that we're covering the bases of the people it will help and hopefully not harming the other people at the same time. The American Society for Reproductive Medicine recommends that we don't do that, but there are some practices that do, and so it's hard to fault them because people do get pregnant. Now, are people getting pregnant because they just got a better embryo, or because something changed and they ended up, the embryo ended up sticking? It's impossible to say. Neupogen is not a benign drug. It's a shot that you have to get. It's an expensive medication to take. And so I am, for the recurring losses, I am more apt to think that, tacrolimus is really a better drug because it does something completely different. It is, but it's pretty well researched, both for recurrent implantation failure and for recurrent pregnancy loss. And so that's one of the things that I do. Let's talk about how that tacrolimus medication works. There are two types of immune cells that we have: a T helper cell type 1 and a T helper cell type 2. It's funny because I just had this conversation earlier. So if that was with you, I hope you don't get bored hearing it again. The type 1 T helper cell is the one that when something invades, all the alarm bells go off. It goes ding, 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 ding. The alarms, the sirens, everything is happening. This type of immune cell is freaking out, man. It is freaking out. It's saying, oh my God, we got to do something here. Whereas the type 2 immune cell is the one that's very laid back. It's the one that says, hey, man, take it easy. We know how to deal with this. We can handle this. We have antibodies for this kind of thing. We can handle this. Type 1 cells are going, yeah, but we have an invader. We have an invader. And the type 2 is going, that's okay. We know what to do here. And it chills out the response. Well, the thinking is in folks who are rejecting a pregnancy, just like in folks who are rejecting an organ transplant, it's those type 1 cells that are winning the race. Too many type 1 cells that are going nuts that say, oh man, this isn't supposed to be here. And the type 2 cells, their voice to say chill out is not having an effect. That's what tacrolimus does. It alters the ratio between type 2 immune cells and the type 1 T helper cells, immune cells. To really increase the ratios. Increasing the ratio meaning to give you more of the type 2 cells than the type 1 cell. So I think that would be a really good place to go. And I think tacrolimus more than I think Neupogen in the situation that you're describing there. Now, for endometriosis, some other things that might be helpful in your situation, since you have suppressed before, low-dose naltrexone may have some effect on endometriosis and increasing the endorphins in your body such that your own body is able to turn down some of the inflammation that's associated with the endometriosis. So that is my thought there. Let's see, Mallory says, good evening, Mallory. Good evening, Mallory. Would you suggest PGT testing for someone who has implantation failure and known endometritis that wasn't necessarily a candidate for PGT in the beginning because of a younger age and no known issues at the time? Yes, I would. So the endometritis problem, which is a chronic inflammation in the lining of the uterus, can easily be treated. We usually treat that with doxycycline. So that one is easy. But recurrent implantation failure, the problem is that we don't know for sure what the situation is with your embryos if they're untested. Now, you are younger, which suggests that you should have more normal embryos, that you're more likely to have normal eggs, but we don't know that for sure. So certainly if you have had a number of transfers and they have been unsuccessful, then I would for sure say, yeah, in the next round, do PGT, because then you can see which of your embryos are chromosomally normal, and we know exactly what we're working with. Now, in our lab here, I can quote you a number based on age to tell you what the pregnancy rate is with untested blasts. But still, that pregnancy rate is going to be much higher in a known euploid embryo. And then we're taking that question about the genetics, that question about the chromosome, we're taking it off the table. So yeah, even though you didn't have to do PGT before, I think after recurrent implantation failure, PGT is probably a really good bet. Let's see. The Florida girl says, "Oh, I can't take tacrolimus; it gives me palpitations." Yeah, that I haven't heard of that side effect, but yeah, then that is unfortunate. Blaxican Beauty here says, "Hey, Dr. Fink, that's the name here. So I got my new thyroid panel back, and everything was normal, except that my 2 antibodies." I guess we're talking about thyroid peroxidase antibody and antithyroglobulin antibodies. But I started taking low-dose naltrexone yesterday to help bring down my antibodies. So actually, what we're talking about here is that she had a situation with hyperthyroidism, that her thyroid volume knob was turned up too high. And as a result, and so she was on a medication that we usually don't want to be on when we're trying to get pregnant. So we've talked about that in the past several weeks before with some advice on that topic. But the thyroid antibodies is something that's called Hashimoto's thyroiditis, Hashimoto's disease, or autoimmune thyroiditis, an autoimmune kind of thyroid inflammation. Your own immune system is creating an antibody against your thyroid gland. There is some evidence that tells us that suppressing a high antibody level from autoimmune thyroiditis is associated with better outcomes in a pregnancy. So in that situation, yeah, low-dose naltrexone may help, but I would outright go to prednisone if that number is really high. Now, if your number was relatively low, just slightly outside of what would be considered normal, let's say less than 100 is a fairly low level of those antithyroid antibodies, then I wouldn't necessarily think about treating it. But sometimes we see them in the 600, 700, 800 or even higher levels. That's a good time for prednisone to treat Hashimoto's thyroiditis. So, but good. I'm glad that your TSH is back where it needs to be. So thank heavens. What a roller coaster ride that one. Taylor, hey, nice to see you tonight. And Shada, as always, a pleasure to see you. Hey to Beach Bum. And Jessica Taylor, thank you. Is that Jessica Taylor? Wrights, I believe. Glad to see you here tonight. Hey, it's a pleasure to be with you, as I am every Tuesday evening at 5 o'clock Central Time, which is 6 on the East, 4 in the mountains, and 3 on the West Coast. Please join me again next Tuesday, won't you, where we can talk about all these things that are important to us, women's health and getting pregnant, and what we do not only with our bodies, but what we do with our hearts. We talked about stress tonight. We talked about how to get rid of some of that anxiety, and I recommend NuCalm, NuCalm. Use the coupon code SLEEP, SLEEP, for a 15% discount because they're giving money away. Hey, remember, this whole pregnancy thing is not the book of your life. This is just a chapter. This ain't your novel. What are we trying to do? We are here to try to rewrite that chapter together. So until next week, every foot forward with kindness to others, every foot forward with love, and every foot forward with hope, knowing that tomorrow is a new day, my friends, full of all new adventures. So until next week, Dr. Randy Fink from Pensacola, thanks so much for being here. Good night.